most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course,
So
Bob.
the topic of today is, do you have sleep apnea? We're going to show you an easy self-test you can do at home. It's a beginner test. I mean, it doesn't confirm that you have it, but if you answer these questions positively, there's a good chance that you should see your doctor and have it checked out further.
Exactly.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away. This week, we're giving away the knee glide that Brad just is so famously showing right now. So you can also find it on Facebook. It'll be pinned to the top of the page, the contest that is. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
That was smooth, Bob.
I thought so. Not
work.
bad for starting the week, right?
That's right.
Okay. So we're talking about mainly, when we talk about sleep apnea, we're talking mainly about obstructive sleep apnea. There's other types, Brad.
Okay.
But this is the one we're talking about. This is the one that occurs when the muscles in the back of your throat relax and your airway closes as you breathe in. So you're sleeping on your back, and all of a sudden, your sleep is interrupted, and you actually wake up. It's only for a brief period of time. You won't even remember that it happened, but it interrupts your sleep. It doesn't allow deep sleep to occur.
Doesn't your breathing actually stop for a certain period of time, and then
it can happen like 5 to 30 times an hour. So it's very disruptive. And the brain senses when you're not breathing, obviously, and that's why it briefly rouses you from your sleep. But the problem with this is because you never reach deep sleep. If I've mentioned this book before, Why We Sleep by Matthew Walker. I mean, this will scare the bejesus out of you if you read this thing, and you're going to make sure you get your sleep the rest of your life if you read this thing. But something like sleep apnea, it can be so dangerous from a medical standpoint because, again, you're not getting into the REM sleep, you're not getting into deep sleep.
Sure.
So it's just disrupting everything, and there's just a whole host of medical problems that can result to that.
Sure.
I'll mention a few of them here. Daytime fatigue, that's an obvious one. You're just going to be tired.
Right. And I've talked to patients who've had this, and they said, wow, and then they've had it corrected.
Right.
And they said, what a difference it makes.
That was a neighbor of mine that he went through that. And I mean, you just think about with driving, like some of you now, we got started this new podcast. If you listen to us when you're driving, hopefully we're keeping you awake here. So we got to talk with a louder voice there.
Yeah.
So, high blood pressure or heart problems can lead to that.
Sure.
Type 2 diabetes, metabolic syndrome linked to increased risk of heart disease. Lots of bad things. It can be complicated with medications and surgery. I mean, it can make complications with medication and surgery.
Well, you think about it, Bob. If you're not breathing well, you're not getting the oxygen in. If your blood oxygen levels drop down, nothing in your whole body works as efficiently as it's supposed to. And then these are the side effects.
To me, it's the lack of sleep, though. I mean, it just, again, there's so many things they talk about in this book I can't even begin to talk about, but it's just no sleep, bad. Plenty sleep, good. Let's put it that way. So, and liver problems, we can result in that. But so what are some of the risk factors? We're going to do the test at the end. We'll go through it all together.
Yep.
But I want to make sure we're doing a complete job here. Some of the risk factors that you may want to look at, and I think a lot of people know these. If you have excess weight, especially, you can see people have that thick neck.
Yeah.
And they have fat deposits around the upper airway. They're just more at risk.
Sure.
So I tell you, I have a cabin, and I invited 3 friends to come there one weekend.
Right.
This was like 5 years ago. Every one of them came walking in with their CPAP. I go, I'm sorry, guys, I'm not part of the CPAP club, but
they let you stay.
They let me stay. Yeah. So you could have an inherited narrow airway. You might be born with it. If you're male, always picking on the males, aren't they?
Well,
2 to 3 times more likely than women.
Well, we deserve it.
Yeah, we deserve it. That's right. Although women are more likely if they're overweight and after menopause. So they're not completely out of the loop here. So number 5, always if you're older. Again, Brad, as we entered our twilight years.
Yeah, well,
Everything-
don't jump the gun. We're still got a good 20 years to go. I look at it
I hope 20
before the
20
twilight, and then we can settle down a little bit.
Okay. Family history. If you take alcohol, sedatives, tranquilizers, obviously that could cause things to relax.
Sure.
I know my brother. He says the only time he snores is after when he drinks.
Right.
So he's always drinking when I see him. So he's always snoring. So.
Oh my! We got it. It's a family show, Bob. Let's keep it.
Well, that's family oriented. He's family, my brother. So smoking, you're 3 times more likely. And if you have nasal congestion, trouble breathing through your nose, you're going to obviously have to breathe more through the throat. So let's take the test, Brad.
Oh,
okay.
Sure.
This has got a unusual name. It's called Stop Bang. And don't say, and
is this a official test?
Yeah. STOPBANG. And each letter stands for something. That's what. That's how you remember it.
Is it called an acronym?
Yeah, an acronym. Yeah. So the stop is snore, tired, observed, pressure. I'll tell you the question. So let's each question that you answer yes, you got to mark down a point for you.
Okay.
Okay. So do you snore loudly? Louder than talking, or loud enough to be heard through closed doors?
I was going to say it's kind of subjective, but I guess when you put those disclaimers in there, I'm very quiet. Everyone agrees.
So I'm a no also on that one.
Yeah, right.
I had a friend again, Kevin. Literally, he said, you're gonna have to put me in a room because I snore so loud.
Yeah.
And then he fell asleep on the couch. Oh my God! It was like a grizzly bear. I'm not kidding you.
Just put a pillow over
I know. I should have. It was a phenomenon. I mean, it was like I wanted to get some popcorn and watch him snore, and then he ended up getting a CPAP machine
get
too.
Earplugs is all.
Oh, I don't know if earplugs would have worked on this guy. It's bad. All right. Do you often feel tired, fatigued, or sleepy during the day? That was a tough one for me. Sometimes I do, not often.
Yeah.
I wouldn't say often.
Well, let's go on. Let's go to the next one.
Okay.
Nobody cares about you anyway.
I don't care about me. Has anyone observed you stop breathing during your sleep?
Well, someone would have to be there. It'd probably have to be your wife.
Right. My wife has seen me. If I'm we're having drinks and I fall asleep on the couch on my back, she goes, "You stop breathing there." So I mean, I'm apparently got the same thing as my brother. If I drink alcohol,
right. Well, you just got to sit up straight or something.
Yeah, that's right. Right, exactly. So I'm going to put yes on that one.
Yeah.
Do you have or are you being treated for high blood pressure? Well, I don't need to know, Brad. That's a personal question, but I'm not. So okay, that's the stop. STOP.
Oh, okay, yeah.
Okay. Now the bang is if you have a BMI over the more than 35 kilograms per M2.
Body mass index.
Yeah, body mass index.
Yeah, and you can look that up on the internet.
We had a video on that. Remember, we just they said we were like
almost obese. Right?
Almost obese.
Yeah,
I don't think we would be anymore. We lost weight since then.
Right, but still, I mean, for this test, evidently they're using that
a high one, right? So I know we're no on that. Age over 50.
I think so.
Yeah, I'm going to have to lie about that one. So that's the BA. So we got another yes. I got another yes. Neck circumference greater than 16 inches.
Oh.
I know mine isn't because I used to be 16 and a half.
Really?
And now I'm like a pencil neck geek. I mean, well,
I noticed
my neck got thinner.
I wasn't going to say anything.
You weren't going to say
No way.
Well, the positive thing is I get a no on this now.
Oh, good. Okay. No. So, yeah, all right. What's
and
next?
Another one where we're male, we're male, gender.
Right.
So we're going to lose out on that one.
Yep. What'd you get?
Well, I got 3 if you want to count the alcohol-induced non-breathing.
Well, yeah, but if you don't have a drink, then you're fine.
Right. Then I have it. Right.
So that one's easily,
So I'd say I'm probably a 2. So if you had a total between 5 and 8, you're at a high risk of OSA, obstructive sleep apnea. If you have between 3 and 4, you're at an intermediate risk of OSA.
Sure.
And if 0 to 2, you're at a low risk. So I'm at like a 2 to 3. So I'm a low to intermediate.
Right.
I would definitely, if you're in the high risk category, I'd definitely go see the doctor at that
Right.
point. If you have
Again,
5
this
days.
is not
No, this is
professionally done, but may give you an idea.
it was done by professionals. It was done by the Ohio Sleep Medicine Institute.
Right.
So,
But there may be some other things.
It's
My
a screening
sister's
test.
she's a a respiratory therapist, and this is what she does. She watches people sleep
oh, she does.
for 12 hours and takes notes. And
Wow.
yeah, she just started a few months ago. So I've talked to her a little bit. I'll talk to her more about
Yeah,
it. Though.
ask her about that. So, what other treatments for CPAP, for OSA? Obviously, CPAP, continuous positive airway pressure.
Oh, sure.
You know, the CPAP. That's obviously the most common one.
Right. You
And-
hook that mask up to your face while you breathe, while you sleep, and it has positive
Yeah.
pressure forcing
that
air
airway
and
to stay
oxygen
there.
into your lungs so that they continue to work
Yeah.
efficiently.
The other thing, one simple change, Brad, is
Oh.
to sleep on your side.
Sure.
I mean, if you can sleep on your side, generally your airway is going to stay open.
And you have less chance of snoring. Is that
Yeah,
correct? Yeah.
yeah,
Okay.
yeah.
That gets two birds with one stone.
Right, there you go.
Two breaths with one stone.
Other lifestyle changes you can make is don't smoke, avoid alcohol, tranquilizers, sleeping pills. Obviously, all those can
Those
play a
things
role.
that allow the muscles to relax.
Right.
Depressants.
Yeah. Lose weight, exercise. A lot of these things that we're going to harp on all the time, no matter what. But they do help.
Yeah.
They do, but
right. Yes. Oftentimes, just not one thing.
so go ahead, take the test. If you score high, we do highly recommend you go ahead and talk to your doctor about this because this is not something to be taken lightly. This will
Right.
affect your health, and you can make a big difference in your life. And maybe you won't be so cranky during the day. Then.
Right.
So
And, they'll put you go in a sleep room and they'll hook you up and they'll observe you sleep for a number of hours and you get to see what
we're
they
running
say.
out of time, Brad. So
Oh yeah, my goodness.
adios.
Take care. Sleep well.